Hi, I'm Dr. Al-Ghazawi, an orthopedic sports medicine surgeon with more than 10 years of experience with shoulder injuries, dislocations. There's a lot of information out there, and it can be a little bit hard to navigate on what's injured, how to treat it, and what the best treatment protocol might be for you. So I wanted to make this video to help give you some confidence in what your treatment options can be and how to go about managing your shoulder dislocation and injuries. In this video, I'll talk about the most common ways people dislocate their shoulders, how we diagnose a shoulder dislocation, and what the best treatment options may be depending on what that shoulder dislocation is. So shoulder dislocations most commonly happen from some sort of contact injury. The most common way to dislocate is anteriorly, out the front of the shoulder. This can happen by pulling your arm up and away, or if someone pulls your arm, or you get tackled, or you fall. These are all ways that the force gets transmitted through your shoulder and the shoulder pops out the front. If you have a seizure disorder, or if you're a lineman in football and you're pushing, then sometimes the shoulder can pop out the back, but that's a less common way to dislocate your shoulder. When you dislocate your shoulder, things got to get injured. That's just the way that goes. So most commonly, you dislocate anteriorly out the front. You can injure your labrum. Labrum is a cartilage ring that goes around the shoulder. Sometimes you can knock a piece of bone off. Sometimes you can actually cause an indentation in the ball itself, the humerus. We think of the shoulder as a ball and socket joint. So those injuries are called a Hill-Sachs lesion. That's the indentation in the bone. And then the tear of the labrum is called a Bankart lesion. So if you see these things on an MRI report, we tend to get x-rays at first. We want to make sure that your shoulder is reduced or put back in place. Sometimes you can do that on the fields if you're playing sports, or sometimes you have to go to the hospital, the emergency room, where they'll help reduce your shoulder by giving you medication. And ultimately, we'll get an MRI and potentially a CT scan. That'll help give us a little bit more information about what's going on in the shoulder, what structures are injured, and potentially what things may need to be fixed. For first-time dislocators, a lot of us will treat these conservatively, meaning physical therapy, rest, anti-inflammatories, and letting your body try to heal that injured shoulder. If you have a large bony piece, you have very specific kinds of Bankart lesions or anterior labral lesions, we know that those don't heal well, and you are just setting yourself up for failure in the future, meaning more dislocations. And every time you dislocate, there's risk to injure the cartilage, knock pieces of cartilage off or bone, and cause a bigger problem that might need a bigger surgery. If you fail conservative treatment options, or you have one of those scenarios that may necessitate a surgery from the get-go, there are arthroscopic techniques, meaning a couple poke holes around your shoulder. We go in with the camera and we use small tools to repair the labrum back to the glenoid or the bone. At the same time, we may be addressing any tendon or other ligament injuries. If you have a very large bony piece or you've had multiple dislocations, sometimes what we're talking about is an open procedure, meaning a larger incision where we're actually trying to recreate the glenoid or the socket. We can take bone from around your shoulder. That's called a ladder shape procedure. Or we can take cadaveric bone or donor bone and recreate the glenoid that way. No matter what option you decide with your surgeon, the physical therapy is an integral part of your recovery. Whether a conservative approach or whether we choose an operative approach, physical therapy is really important in getting you your range of motion back and then getting you ready to play sports again, or just have a pain-free shoulder. If we end up repairing your Bankart lesion, your labral tear, or doing an open procedure, the healing time is somewhere between 3 and 4 months. To get back to contact sports, it's probably closer to 6 months of recovery. Ultimately, it's important to find the right orthopedic sports medicine surgeon for you in your area. Have a great discussion with them about your treatment options and their techniques. Make sure that you're comfortable with your plan going forward. If you found this video helpful, feel free to like and subscribe. If you have any questions, send them my way, whether it's via email or make an appointment at the office to see me in person. You can call 212-737-3301.